Hi, I'm Amy McCarter. Welcome to House Calls, brought to you by KaMMCO, where Kansas healthcare professionals deliver health insight. Today I'll be speaking with Dr. Doug Iliff of Topeka about cholesterol health. Welcome, Dr. Iliff, and thank you for being here.
You're welcome.
Dr. Iliff, on January 23rd, the Wall Street Journal featured a series of healthcare debates. One of them was about the question, should healthy people take cholesterol drugs to prevent heart disease? What's your take on this?
The cholesterol drugs are the statins, like simvastatin, which went by the trade name Zocor, and Lipitor or Crestor, which you've probably seen advertised on TV. Here are a couple of graphs for background. First, this is the rise in obesity in America over the last 50 years. The top line includes obese and overweight people, and we're topping 70% now. With obesity comes diabetes, hypertension, and heart disease. Now here's a graph of deaths from heart disease and stroke on the top line. Cancer is the line on the bottom.
So what's happened?
Lots of things, but the dramatic drop like this hasn't been due to angioplasty or eating your veggies. Everybody agrees that the statin drugs, which dramatically reduce cholesterol levels, are responsible for most of the decrease in deaths.
So what's the controversy?
The debate is about whether to give these drugs to patients who have never had heart disease or strokes and who have less than a 10% chance of such an event over the next 10 years, statistically speaking. Some experts claim there is little evidence that such a strategy would have a large impact, and the drugs are expensive and they have side effects.
That makes sense. What's the other side?
We know that high levels of LDL, the bad cholesterol, infiltrate the walls of arteries all over the body, including the brain and kidneys, as well as the heart. We know from Korean War autopsy studies that the process starts in our 20s. Finally, we know that simvastatin is cheap, but atorvastatin will be cheap very soon, and serious side effects are really rare. So if I told you that your cholesterol was too high, would you take a pill every day to fix it?
It's a really tough decision.
Yes, it is.
What would you do in my case?
The first thing would be to practice TLC, that is therapeutic lifestyle change, basically diet and exercise. But I would have to warn you, hypertension and diabetes respond well to TLC, but cholesterol is mostly genetic. You can raise your good cholesterol with really vigorous exercise, but very few patients will do that. 20 years ago, my LDL cholesterol was high, and my grandbrothers died of heart disease in their 50s. I ran a couple of Boston marathons in a little over 3 hours, and my blood pressure and glucose levels were normal.
And so?
Well, I've been taking statins ever since they were approved by the FDA. That doesn't mean I did the right thing. We may never know the right answer. Being a doctor or a patient means making decisions based on imperfect information.
Thank you, Dr. Iliff, for being our guest today on House Calls. Please join us next Saturday morning for a new health topic discussion on House Calls.